Hello, my name is Todd Laffaye, and welcome to my senior TED Talk. My research question was, what are the most promising treatment options available for patients with Alzheimer's disease? In my research, I was actually able to identify a drug called aducanumab as the most promising treatment option. But first, I'd like to start by asking you to raise your hand if you personally know anyone who has been affected by Alzheimer's disease. As those of you who raised your hands know, Alzheimer's is one of the most devastating and detrimental illnesses we face in our world today. There is nothing harder than watching a loved one forget your name during their final stages of life. Furthermore, the number of people with Alzheimer's disease is growing. More than 5 million people are currently living with Alzheimer's disease. By 2050, this number could easily be as high as 16 million. Also, 2017 marked the first year that the cost of Alzheimer's-related treatment passed $250 billion. So, this begs the question, what makes Alzheimer's disease so bad? The answer lies within the pathophysiology of the disease, meaning the physical changes that happen within a diseased brain. Firstly, Alzheimer's is a terminal illness. This means it is an incurable disease that is reasonably expected to result in the death of a patient within a short time after receiving a diagnosis. In Alzheimer's disease, normal parts of the brain malfunction. These malfunctions are the pathophysiological changes that lead to the main hallmarks of Alzheimer's. These hallmarks are reduced acetylcholine levels, increased glutamate levels, the presence of amyloid beta plaque, neurofibrillary tangles, and neuroinflammation. These two hallmarks, amyloid beta plaques and neurofibrillary tangles, are considered to be the two main issues in Alzheimer's, which in turn means they have the most potential for promising treatment options to be built up around them. This is important because in order to develop a treatment, you have to fully understand the way the disease changes the brain. Starting with amyloid plaques, these are basically clumps that are caused by specific peptides, which you can think of as short chains of amino acids, which become misfolded. And when they become misfolded, it actually causes them to aggregate together. And these aggregates are cystotoxic, which means they're toxic to the living cells around them. And this causes widespread neuronal death within the brain. Secondly, neurofibrillary tangles are caused by the hyperphosphorylation or overphosphorylation of Tau, which is a protein that stabilizes microtubes within cells. In Alzheimer's disease, these proteins become twisted, and it actually causes the entire cell itself to malfunction. And this malfunction leads to neuronal death. These two main hallmarks help cause and contribute the other hallmarks of Alzheimer's disease, which are those reduced acetylcholine levels, increased glutamate levels, and neuroinflammation. Starting with acetylcholine, acetylcholine is basically a neurotransmitter, and reduced levels in Alzheimer's disease causes cognitive decline and other neurological defects. Glutamate is also a neurotransmitter, but unlike acetylcholine, it's actually toxic at higher levels, and in Alzheimer's disease, it's seen at much higher levels than it would be in a normal brain. And lastly, neuroinflammation is just simply inflammation of the brain, and this causes brain swelling and neuronal death within those areas of swelling. And again, these three things are caused by the presence of neurofibrillary tangles and amyloid plaque. So we have our main two hallmarks identified, but how do we actually fix these problems? The answer is, in terms of an Alzheimer's disease treatment, a drug has to be disease modifying. This means it has to actually change the progression of the disease. With that said, amyloid plaques are the main hallmark that should be focused on, because they're one of the main changes in the brain associated with Alzheimer's, and more is known about amyloid plaques than neurofibrillary tangles. Knowing that, let's dive a little deeper into amyloid plaques. So this is a nice visual representation of what amyloid plaques actually look like on the microscopic level. And you can see how they're literally just these aggregates that form in between neurons, which in this picture are depicted as those purple objects. And in the realm of Alzheimer's disease treatment, there's actually a term called the Amyloid Hypothesis. And this term defines amyloid as basically the central event as to what goes wrong in an Alzheimer's disease brain. And this way of thinking has actually dominated research for the past 20 years. Furthermore, due to the fact that amyloid is located in the brain, on top of the usual issues with trying to target something and eliminate it, amyloid-targeted treatment methods must also complete the challenge of crossing what's known as the blood-brain barrier. And this barrier can be thought of as a great filter, which only allows certain particles to pass through from the blood vessels around the brain into the actual brain area itself. And this brings us to the drug aducanumab. Of the current drugs that are able to cross the blood-brain barrier, target, and eliminate amyloid plaque, aducanumab has been shown to be the best of the best. It is disease-modifying and is currently in 2 phase 3 clinical trials, which is actually the last phase before a drug can become openly available on the public market. Aducanumab works via the specific treatment method of removal of these amyloid plaques by using intravenous passive immunotherapy. The term passive immunotherapy refers to a treatment method that works by using antibodies that are engineered outside of the human body and then administered into the patient to help fight the disease. And intravenous simply means through the veins. And in case you don't know, antibodies are these. They are microscopic objects that are part of the immune system. Antibodies are made to bind to specific things, and when they do, they signal the body's immune system to destroy what they are binded to. The drug aducanumab is simply an injection of these antibodies, which are given monthly and designed to bind to amyloid clumps. After binding, the body's own immune system does the rest of the work by eliminating the amyloid plaques, which effectively changes the progression of the disease. By doing this, aducanumab does what no other drugs in the entire realm of Alzheimer's treatment are able to do, which is actually change the progression. This is key as to why aducanumab is so promising, because none of the drugs currently available for Alzheimer's do anything close to this. Rather, they are known as what's called symptomatic drugs. This means they treat the symptoms caused by Alzheimer's disease, but not the underlying cause of the disease itself, which would be these amyloid plaques. This disease modification in aducanumab was actually first found in a phase 2 clinical trial that was primarily looking for safety. So for context, clinical trial processes come in 3 main phases. Phase 1 clinical trials are almost exclusively looking for safety, and they're done with a very small patient population. Phase 2 clinical trials are primarily looking for safety, but also for how well the drug works, and these are done with a slightly larger patient population. And Phase 3 clinical trials are almost exclusively looking for how well the drug works, and this is done with a much larger patient population. So here's a picture of a thing called amyloid imaging. And amyloid imaging basically allows you to see the relative concentration of these amyloid plaques within Alzheimer's disease patients' brains. So these are baseline images of 4 different individuals. So they were taken before any of these people had been treated with aducanumab. And in these pictures, the areas that are more red suggest a higher concentration of amyloid. And here's a picture of what the concentration looked like after 1 year after a patient had been treated with a placebo. So placebo is basically a fake drug, and they're often used in the clinical trial process to help prove a real drug's effectiveness. This is because researchers can compare how the brain changes when patients think they're being treated with a drug, but they're not actually being treated on a placebo, versus when they're actually being treated with the drug. So this is what it actually looked like after patients had been treated with varying doses of aducanumab for 1 year. And as you can see, there's a clear reduction in the amount of amyloid plaque present within these brains. And this effect was greatest at what's known as the maximum effective dose, which in this case was this bottom one here at 10 milligrams per kilogram. In research, it was also found that aducanumab was able to slow the clinical decline and improve cognition in patients. This basically means that after being treated, patients were able to remember things for longer and their overall mental function was improved. Not only can aducanumab do this, but it can also be individualized to meet the specific needs of patients. In my research, I was also able to talk to Dr. Brent Forrester, who is a current Alzheimer's researcher and director of psychology at the Harvard School of Medicine. Not only did he agree with me that aducanumab is the most promising treatment option for Alzheimer's, but he was also able to tell me about how it can be tailored for individualized use and virtually eliminate side effects. In early stages of the clinical trial process, side effects were found, but only in certain people. Realizing this, and through an intensive investigation, researchers were able to find a direct correlation between the gene APOE4, the rate at which increasing dosages increments of aducanumab were increased, and the side effects they were seeing. This basically means that by using a gene screening process before starting treatment, if patients were found to possess the gene APOE4, they were then treated at a slower rate of increasing increments of dosage, and if this was done correctly, virtually all side effects were eliminated. And this is huge because it means aducanumab can be available to anyone without any side effects. All things considered, there is no doubt that aducanumab is the most promising treatment option for Alzheimer's disease. If things continue to stay on track, aducanumab will become widely available by late 2020. This is big news because aducanumab will change the game in Alzheimer's treatment when it is needed most. It is currently estimated that 1 in 10 people aged 65 or older have been clinically diagnosed with Alzheimer's disease. But it is believed that only 45% of the people with Alzheimer's disease receive a diagnosis. This means that approximately 1 in 5 people aged 65 or older are experiencing changes in the brain related to Alzheimer's. That means that in this room alone, 3 people will develop Alzheimer's disease in their late life. The time for a new, effective treatment is now. Thank you.
All right, thank you, Todd.